Today, we're at a theme park to help solve your medical mysteries.
If you're anxious about an ailment
Or curious about a condition,
then the Ouchmobile is the place for you.
That is incredible.
Xand is preparing the clinic ready for his first patient.
And Chris is out in the park to answer your burning questions.
At the clinic, Xand is open for business.
Can I have the next patient?
Hi, Dr. Xand.
First in is 11-year-old Eugene with a question about an itchy ailment on his arms.
So, Eugene, what's brought you to the Ouchmobile today?
Well, I've got something really itchy and annoying on my arms.
What's the diagnosis, Doc?
Sounds to me like a case of I've got something really annoying and itchy on my arms-itis.
Spot on.
So what we're looking at here is actually something called eczema.
It happens when too many skin cells are produced, and it's also a chance for Xand to show off his doctor skills.
What I can see here is xerodermia, lichenification, and excoriations. What that really means is it's just the Greek words for dry skin, itchiness, rough skin.
Yeah, okay, Xand. Anything you want to ask Eugene?
Is there anything I can do to make my eczema better?
Keeping it really well moisturised will stop it itching and keep that skin looking nice. Beyond that, avoiding itchy fabrics like wool, nylon, polyester, things like that. Apart from that, one of the things you can do is get older. So as you get older, it's likely that it'll clear up, and lots of people who have eczema when they're children don't have it when they're adults.
Away from the clinic, Chris is out and about in the park, solving your medical mysteries.
Why do we get brain freeze when we eat ice cream?
Well, it's to do with when the cold ice cream gets into your mouth, on a hot day, the nerves in your mouth contract all the blood vessels around your mouth, because blood is one of the ways of your body cooling itself down. So you get pain from the nerves from the cold, and you get changes in the amount of blood in your head, and that's what hurts.
Why do you sprain your muscles?
If you move a muscle when you're not ready to use it, you can actually tear all the little fibers that make it work. And they'll heal up, and they may even heal up stronger. That's why weightlifting makes us stronger. It tears our muscles. But in the short term, it swells up and it really hurts. But it almost always gets better.
Back at the Ouchmobile, there's a new case in the waiting room.
Next patient, please.
And it's 11-year-old James with a curious case on his face.
So, James, what's brought you to the Ouchmobile today?
Well, I have a birthmark shaped like Britain.
Wow, look at that. What's the diagnosis, Doc?
Sounds like a case of I've got a birthmark shaped like Britain on my face-itis.
That's exactly what I'd say.
It really does look...
Today, we're at a theme park.
To help solve your medical mysteries.
If you're anxious about an ailment,
Or curious about a condition,
then the Ouchmobile is the place for you.
That is incredible.
Chris is preparing the clinic ready for his first patient.
And Xand is out in the park to answer your burning questions.
At the clinic, Chris is open for business.
Next patient, please.
First in is 9-year-old Shoma with a question about some frightful findings on his feet.
I've got a bunch of verrucas on my foot that won't go away.
Well, what have you got to say about this, Chris?
This sounds like a rare case of I've got a bunch of verrucas on my foot and they won't go away itis.
And breathe. Now let's have a look.
Yeah, 1, 2, 3. A little cluster of them here. Now that's the big daddy verruca there. And more up here.
That's an impressive 9 verrucas on one foot.
How do you get verrucas?
So verrucas are viruses, so you get them from walking around where other people with verrucas have walked. So the virus has got quite a cool name. Do you want to know what it is?
Yeah.
It's called a human papilloma virus. Can you say that?
A human papilloma virus.
Nice one, Shoma. The virus causes your skin to grow in an uncontrollable way, leading to these lumps. But the good news is they often go away on their own.
The important thing if you have a verruca is to not spread it too much to other people. So when you go swimming, you've got to wear a verruca sock. When you play PE, you've got to keep your shoes on.
And don't worry, if you have verrucas, they'll probably soon disappear by themselves.
Away from the clinic, Xand is out and about in the park.
And let's see if there are any medical mysteries, or maybe people have got some questions for me.
Why does your heart beat fast on roller coasters?
When you're frightened, your body releases a hormone called adrenaline, and that makes your heart beat faster because your body thinks it might have to run away.
If a tiger attacked you, you get a load of adrenaline and then your heart beat faster and you'd be able to run away faster. That's what your body's doing, it's preparing to run away, even though you're strapped into a roller coaster.
Look what I did today.
Oh no, that's terrible. What happened?
Well, I was going on the ride and I hit my leg on the side of the ride.
Oh, was it painful?
Yeah.
So what happens when you get a bruise is you break the blood vessels under your skin. What you're seeing there is bleeding under the skin. So all that stuff that looks black is actually red blood, and it will gradually change colour as it heals.
Back at the Ouchmobile, there's a new case in the waiting room.
Hi, Dr. Chris.
It's 10-year-old Mohammed, and he's got something incredible to show us.
Mohammed, why have you come to the Ouchmobile today?
I can fold my ear and stick it in this hole here.
You fold your ear in what? Diagnose this, Chris.
So this sounds like a very rare case of I can fold my ear up and stick it in this hole here, itis.
I can't wait to see it. Wow!
That is the most bendy ear I've ever seen. Okay, Mohammed, give it a little wiggle and make it pop out.
Well, let's see that again.
How come I can do that with my ear?
Well, inside your ear, you've got some very bendy stuff called cartilage, and it's the same stuff that's in your nose. So I don't think there's anything wrong with your cartilage. It's just nice and soft, and you've got bendy ears.
Job done for today. Clinic closed.
We've come to a theme park to help solve your medical mysteries. Xand is preparing the clinic ready for his first patient.
While Chris is out in the park to answer your burning questions.
At the clinic, Xand is open for business.
Can I have the next patient, please?
First up, it's not that Doug. It's 8-year-old Thomas, and he's had a mouthful of his problem.
So Thomas, why have you come to the Ouchmobile today?
Well, I've hardly lost any of my milk teeth, but all my friends have.
What's the diagnosis, Xand?
Sounds to me like a case of I've hardly lost any of my milk teeth, but all my friends have itis.
Excellent diagnosis.
How many have you lost?
I've lost 4. Yeah, and I've got one, lucky one.
Right, let's have a look. Give that one a wobble for me. Oh, that's brilliant, look at that. And part of the explanation is that everyone's different, right? Like, you and your friends are all going to be different sizes, you've all got different colour hair, I mean, there's lots of different things about you, and your teeth are one of those different things. You're also all different ages, and in your case, there isn't anything to worry about.
Xand's right, Thomas. It's all good. Now I'm out and about, solving more medical mysteries.
What causes hiccups?
Do you ever get a thing where your eyelid flickers a little bit and you can't control it? Hiccups are a bit like that. It's the muscle under your lungs called your diaphragm. When the diaphragm spasms, you get that hic.
Dr. Chris, why do we get trapped lips in the winter?
It's because in the summer we sweat, and so we leak lots of grease out from our pores, which keeps our skin nice and moist. And in the winter that doesn't happen. So when we lick our lips, we dry them out even more, because we lick the grease off them. And so that's when they start flaking and peeling and cracking. Does that make sense?
Yeah.
Back at the Ouchmobile, some fellow twins are in the waiting room.
Next patient, please.
But their question is all to do with their differences.
So, India, Orchid, what's brought you to the Ouchmobile?
I'm right-handed and I'm left-handed. I've got bigger feet and I got smaller feet. I'm shorter and she's taller, and we want to know why.
Double trouble. What's the diagnosis, Doc?
This sounds like a case of right twin, left twin, big foot, small foot, tall twin, short twin-itis.
Sounds twintastic.
Who's the older twin?
I'm the older twin.
I'm the older twin, actually, as well.
How much older are you?
I'm 7 minutes older than Dr. Chris.
We're 10. I'm 10
You're 10 minutes,
older.
so you're taller, older, bigger feet.
Yeah.
So it's quite interesting. So when twins are developing inside their mum before they're born, there isn't as much room as there would be if there's just one baby. And one twin is usually a bit bigger than the other. There's a bit of competition for nutrients. So it looks like, India, you've just been the slightly larger twin. Were you bigger when you were born?
I think by 1 pound or something.
Well, about a pound. I think that's probably the explanation if you've just always been the slightly larger twin.
And the left-handed thing?
Normally in the population, people who aren't twins, about 1 in 10 people is left-handed. But in twins, it's actually 1 in 5, so it's twice as common.
But no one's exactly sure why.
Dear Orchid, thanks very much for coming in. It's really nice to have twins on the show.
Job done for today. Clinic closed.
Today, we're at a theme park to help solve your medical mysteries.
If you're anxious about an ailment,
Or curious about a condition?
then the Ouchmobile is the place for you.
That is incredible.
Chris is preparing the clinic ready for his first patient.
And Xand is out in the park to answer your burning questions.
At the clinic, Chris is open for business.
Next patient, please.
First in is brother-sister tag team, 9-year-old Arman and Tamana, age 10.
What has brought you to the Ouchmobile today?
I've got a terrifying rotten gum.
Tamana, what have you got?
I think I've got a tooth on top of another.
What's your double diagnosis, Doc?
This sounds like a rare case of terrifying rotten gum and a tooth on top of another tooth, all in the same family, itis.
Easy for you to say.
Open wide. Now, how long have you had this problem for?
As long as I live.
As long as you've lived. So I don't think you've got an extra tooth. I think the tooth are crowded, so that one's being squeezed out.
What can I do about it?
Well, you can see a dentist is probably the best thing.
Okay.
Right, open wide. Oh, look at that.
Ouch! A bad case of tooth decay.
Half your tooth is missing. So, Arman, how long do you brush your teeth for?
50 seconds.
50 seconds. Tamana, how long does your brother?
5 to 10 seconds.
5 to 10 seconds.
This could be the reason why Arman's tooth is rotten. Teeth need looking after, and that means brushing them twice a day for about 2 minutes.
And how many times a day do you brush your teeth?
Once.
And how often should you brush your teeth?
Twice.
Arman's tooth will need to be taken out, but to keep the rest of his gnashers, he needs to get brushing. It can be boring though, so any tips, Chris?
Stand on one leg for a minute while you brush the bottom half of your teeth, and then you stand on the other leg for a minute while you brush the top half of your teeth.
I'm impressed. I think I'll try that myself.
Away from the clinic, Xand is ouching about in the park.
Dr. Xand, I have something that I need to show you.
You've got bleeding under your nail and the blood's got old, so it's gone black. That white line is how far your nail has grown since you injured it. In about 4 months, that'll get to the front and your nail might fall off, but then it'll grow back again, so you'll be fine.
Why is it when you go upside down on roller coasters, does your face go red, but when you walk normally, your feet aren't red?
Because you're designed to stand up, not stand on your head, there are actually valves which only allow the blood to go one direction around your body. So if the blood tries to go backwards into your feet, it can't go that direction. Does that make sense?
Yeah.
It's an excellent question.
Back at the Ouchmobile, there's a new case in the waiting room.
Next patient, please.
And it's 10-year-old Alex, who's got some fascinating features on his fingers.
So, Alex, what brings you to the Ouchmobile today?
I've got a really weird thing where both my little fingers are bent.
What's the diagnosis, Doc?
It sounds to me like a case of I've got a really weird thing where both my little fingers are bent, itis.
That's right, Chris.
So what we can see here is that the last bit of the little finger on both hands is just bending in. And that's because this bone has a slightly odd shape. So instead of being flat, that's just twisted in. So do you know what this is called?
Delta phalanx deformity.
Way to go, Dr. Alex.
We can also call it fifth finger clinodactyly.
Oh yes, the Greek for,
Bent little finger.
Exactly.
Will they ever go back to normal shape?
They're never going to grow straight because the bone in the finger is a different shape on both sides, so it will always be bent. Now, it may be possible to have some exercises that make the things you want to do a bit easier.
Okay, thanks, Dr. Chris.
That's a pleasure.
Job done for today, clinic closed. Today we're at a theme park to help solve your medical mysteries.
If you're anxious about an ailment,
Or curious about a condition,
then the Ouchmobile is the place for you.
That is incredible.
Xand is preparing the clinic ready for his first patient.
And Chris is out in the park to answer your burning questions.
The clinic is now open for business.
Can I have the next patient, please?
First in is 8-year-old Grace, who's had an eyeful of her ailment.
So, Grace, what's brought you to the Ouchmobile today?
When I fall asleep and wake up, my eyes get all crusty and red.
Diagnosis, please, Doc.
Sounds like a case of when I fall asleep and wake up, my eyes get really crusty and red itis.
That's exactly what I'd say.
What we can see is your eyelids are quite red and inflamed, and you've got those little crusty bits in your eyelashes. So you've actually got a problem called blepharitis. So it is a real itis in this case.
What can I do about it?
The first thing is getting a towel and just soaking your eyelids, and that makes the crust a bit easier to remove. And then sometimes you do get these big flare-ups. In that case, obviously, you need to go to the doctor, and they can either give you some drops or they can give you some antibiotic pills as well. The good news, though, is that it's not really serious.
Thank you, Dr. Xand.
Away from the clinic, Chris is out and about in the park, solving your medical mysteries.
Why doesn't hair grow back on scars?
That's because when you're born, you've got a certain number of hair follicles, and you can never grow any more hair follicles. So if we cut your skin, when that bit of skin heals, you get the scar, but there are no cells that produce hair there. So you will always have a small bald bit.
Why is your funny bone called your funny bone?
And why is it when you bang it, there's a tingle?
So in fact, you're both asking the same question. And the funny thing about your funny bone is it's not a bone, it's a nerve. And it's your ulnar nerve, and it runs through a little groove there, which you can feel. And when you bang the nerve, you get that tingling going all the way down your arm. That's what feels funny.
Back at the Ouchmobile, there's a new case in the waiting room.
Next patient, please.
And it's 7-year-old Bobby with the story about his skin.
So, Bobby, why have you come to the Ouchmobile today?
I wanted to show you my leopard spot.
You've got a leopard spot.
Look at that. Diagnosis, please, Doc.
Sounds to me like a case of I've got a leopard spotitis.
Spot on.
That is a real leopard spot, and it's very interesting. It's a birthmark, right? You've had it since you were born. Most birthmarks are dark in colour, and this one is mostly light in colour. So it's what we call hypopigmented. It means it's got less ink in it, effectively.
So what causes it?
In your skin, you've got cells called melanocytes, and they make your skin brown. So when you've got a patch of very pale skin like you've got there, it means it's got very few melanocytes in it at all. And that started when you were just a tiny ball of cells inside your mum, and since then, you've had that birthmark. So I don't think there's anything you need to worry about at all. It's just a really cool looking birthmark.
Job done for today. Clinic closed.
Today, we're at a theme park to help solve your medical mysteries.
If you're anxious about an ailment or curious about a condition, then the Ouchmobile is the place for you.
That is incredible.
Xand is preparing the clinic ready for his first patient.
And Chris is out in the park to answer your burning questions.
Now we're ready for business.
Can I see the next patient?
First up is Anastasia, with something she feels she needs to keep a watch on.
So Anastasia, what's brought you to the Ouchmobile today?
I have something strange hidden under my watch.
So, what's the diagnosis, Doc?
Sounds to me like a case of I've got something strange hidden under my watchitis.
That's exactly what I'd say. Let's have a look then.
Oh, that's great. So that is what a doctor would call a compound melanocytic nevus. It's a mole. So what you can see here is a very typical mole. It's quite a big one, but it's got irregular edges. It's a patch of darker skin than the surrounding skin, and it's slightly raised, but it looks like a very typical mole.
How do I know if it's dangerous?
Sometimes moles can cause trouble. The things that you'd look for, if it changes shape, it changes size, if it changes colour particularly, or it becomes itchy, or it starts to bleed at all, any of those changes, you want to take it to your GP and get them to have a look at it.
Thanks for answering my questions, Dr. Xand.
Away from the clinic, Chris is out and about in the park solving your medical mysteries.
Dr. Chris, why do you get pins and needles sometimes when you lie in a weird position?
When you're in a weird position with either your leg or your arm, what's happened is you cut off the blood supply to that limb. So often you'll find that the arm or leg goes dead and you can't feel anything at all. And as the blood and oxygen go back to the nerves, they wake up again and start sending all sorts of weird signals back to your brain, which you feel as pins and needles.
Why do you have a stitch when you run?
You'll notice your stitch is worse if you run soon after you've eaten. And that's because when you run, you want to send all the blood in your body to your muscles so they can do work. And that takes the blood away from your guts. And if you've eaten food, your guts are trying to digest the food. And if they lack blood, then they start to hurt and they start to complain because they want more blood. So if you run on an empty stomach and you warm up slowly, you won't get the stitch.
Back at the clinic, there's a familiar face in the waiting room.
Can I have the next patient? Oh, it's you again, Anastasia.
Yep, she's back for more.
So Anastasia, how come you're back?
All my friends in my school have an innie belly button, but I have an outie.
What's the diagnosis, Doc?
Sounds to me like a case of I've got a belly button that doesn't know where it's supposed to be itis.
Spot on.
That is a very impressive outie belly button.
So why do I get an outie belly button?
When you're inside your mum before you're born, you need to get fed, and you don't get fed through your mouth, you actually get fed through your belly button, through a thing called the umbilical cord, and that gets blood and nutrients and oxygen into your body. And after you're born, you don't need it, so we clamp it off, and the cord just dies and falls off. And usually, when things die and drop off, you get a bit of a scar formation. That scar tightens up and pulls the belly button in. But in lots of people, that doesn't happen. But it's not a problem, it's completely normal. In fact, it's quite special.
Special.
Job done for today, clinic closed. Today, we're at a theme park to help you solve your medical mysteries.
If you're anxious about an ailment,
Or curious about a condition,
then the Ouchmobile is the place for you.
That's brilliant, look at that.
Xand is preparing the clinic ready for his patients. And later, he'll be out in the park to answer your burning questions. At the clinic, he's open for business.
Can I have the next patient?
First in is 8-year-old Zoe with a question about some bendy bits on her body.
So Zoe, why have you come to the Ouchmobile?
So I've got a really bendy body.
What's the diagnosis, Doc?
This sounds like a case of I've got a really bendy bodyitis.
That's what I'd say.
Can I have a look at what you can do?
I can't bend my arm all the way around.
Oh, well, I think I can do that. Oh, wait a minute. You're doing a thumbs up while I'm doing a thumbs down.
Yeah.
Wow, that's amazing. What else can you do?
Touch my elbows behind my back.
Okay, I can at least do this one. Are they touching? Are they close?
No.
Oh.
Why do I bend so much and my friends don't?
What you've got is a thing called hypermobility. Most of the time, your joints are held in place by things called ligaments, and they're like very tough elastic bands that keep the bones together. Now, those ligaments are mostly made of something called collagen, and in most people, the collagen is quite tough, but for you, it's a bit more flexible, it's a bit stretchier, and that means that your joints can move a little bit more. It doesn't do you any harm, though, but it does mean that you're a bit more bendy than other people.
It's a busy day for Xand. He's leaving the clinic to go out and about in the park to solve your medical mysteries.
Why do you get heat rash when it's hot?
Ordinarily, what you're trying to do when you're hot is send all the blood to the surface of your skin, and then as your sweat evaporates, it cools that blood down. You get colder. But when you get a heat rash, all the blood going to your skin irritates it, and it gets itchy and it gets red. So what you really need to do is cool down some other way, like cold water or a cold t-shirt, or just get in the shade.
Why do you shiver after you've been on a wet ride?
Shivering is your body's attempt to warm up, because you get all your muscles working. It's very hard work shivering, and it's a bit like going for a run without having to go for the run. You get all your muscles shaking, that generates heat, and you feel a bit warmer. The best thing to do is dry off, though.
Back at the Ouchmobile, there's a new case in the waiting room.
Can I have the next patient?
It's 9-year-old Beth with a nuisance on her knee.
So, Beth, what's brought you to the Ouchmobile today?
I've got two things going on my knee.
What's the diagnosis, Doc?
Sounds like a case of I've got two things going on my knee-itis.
2 for the price of 1.
Oh, wow, that's interesting. What we can see there is you've clearly got a scab, and around it, you can see the skin's raised, it's quite hard, it's dried out, it's rough.
That's a condition called psoriasis.
What's happening in psoriasis is the cells in your skin that make the tough outer layer of your skin, it's called keratin, they overgrow for some reason. They're more active, they're making more keratin. That's what making that bit of skin kind of rough and thick and hard.
Why won't my psoriasis heal? It's been like that since I was around 4 and 5.
Sometimes it goes away over time, and sometimes it doesn't. So I'd say for the moment, the best you can do is leave it alone. If it doesn't go away or if it gets worse, then it's well worth going to see a doctor. There are drugs that they could use to treat it, but hopefully it'll die down of its own accord.
Job done for today, clinic closed.
Today we're at a theme park to help solve your medical mysteries.
If you're anxious about an ailment,
Or curious about a condition,
then the Ouchmobile is the place for you.
That is incredible.
Chris is preparing the clinic ready for his first patient.
and Xand is out in the park to answer your burning questions.
At the clinic, Chris is open for business.
Next patient, please.
First in is 10-year-old Soraya with a question about some troublesome teeth.
Soraya, why have you come to the Ultramobile today?
Because I've got an interesting extra tooth in between my two front teeth.
What's the diagnosis, Doc?
This sounds like a case of I've got an interesting extra tooth between my two front teeth, itis.
Sounds right to me.
Open wide, and there he is, look at that. So, when you're born, all your grown-up teeth are already in your jaw. And when your milk teeth are falling out, it's because your grown-up teeth are pushing them through. And I think what's happened is that tooth is an old milk tooth. And as the two big grown-up teeth have come through, they've pushed that one back.
Will my extra tooth ever fall out?
In some people, they do fall out, but probably you're going to need it taken out by a dentist. The good news is most of the time the dentist will put you to sleep, so you won't feel a thing, you just wake up and the tooth is gone.
Away from the clinic, Xand is out and about in the park.
Why does your tummy flip when you go up or down on a roller coaster?
Inside you, not everything is firmly fixed down. So there are some bits of your body that are quite firmly attached and don't move much, but your stomach isn't one of them. It's quite elastic and it can move around. So what is literally happening is you're going up and your stomach's being pulled down, and then as you go over the hill, your stomach keeps going up and you start going down again. So your stomach is almost flipping. It can make you feel a bit sick.
Dr. Xand, how do antibiotics know which part of your body to affect?
What's happening is every cell in your body is exposed to the antibiotics. But you can imagine the bacteria are quite different cells to the ones in your body. Like they just work in different ways. They've got different enzymes, different proteins, and so on. And so the antibiotics are specially designed to interfere with the bacteria without interfering with the cells in your body. It's a very difficult question.
Back at the Ultramobile, there's a new case in the waiting room.
Next patient, please.
And it's 8-year-old Cassius, whose toes need some tending.
So Cassius, what brings you to the Ultramobile?
On one of my feet, on all of my toes, on all of my nails, they're goldeny yellow.
What's the diagnosis, Doc?
So this sounds like a rare case of, on one of my feet, on all of my toes, all of my nails are goldeny yellow itis.
Easy for you to say.
Goodness me, yeah. I can see under your nails is also infected. The fungus that has infected your nails is a bit like a mushroom. And if you ever go to a mushroom farm, they have to grow in dark, damp conditions, a bit like the conditions we find in your shoe.
What can I do about it?
Well, there are a couple of things you can do. You can take medication, you can get antifungal treatments that you paint on the nail. The second thing you can do is wear quite loose-fitting shoes that breathe easily, and sometimes on a sunny day like this, you should just wear flip-flops.
And don't forget to change your socks every day too.
Job done for today, clinic closed.